Amniotic fluid. This is a protective liquid that surrounds the fetus within the amniotic sac, providing the cushioned and the controlled environment for the development. 98% of the water and the 2% of the solutes. Proteins, carbohydrate, lipid, electrolytes, fetal cells and the hormones. Contains a vernix seals, lanugo and the fetal urine components. Production. Act as a shock absorber. Temperature regulation. Maintains a stable environment. Fetal movement allows an unrestricted movement for the musculoskeletal development. Lung development. Aids in the lung maturation through the fetal breathing movement. Prevents the cord compression. Ensures the proper blood flow to the uterus. Immune role. Contains antimicrobial properties. Production and the circulation. Early pregnancy is secreted by the maternal plasma via the amnion. Second trimester onwards, fetal urine becomes a primary source, absorbed through the fetal swallowing and reabsorbed via the placenta. Amniotic fluid volume changes. Peaks at 800 to 1000 ml at 32 to 34 weeks, decreases to 500 to 600 ml at term. Disorders of the amniotic fluid volume. Oligohydramnios, AFI, less than 5 cm or less than 500 ml at term. Causes placental insufficiency, fetal renal anomalies, renal agenesis, Porter syndrome. Prom. Pre-labor rupture of the membrane. Complication. Pulmonary hyperplasia, limb deformities, umbilical cord compression. Polyhydramnios, AFI, greater than 25 cm or greater than 2000 ml. Causes maternal diabetes, fetal GI obstruction, duodenal atresia, esophageal area, twin-to-twin transmission syndrome, preterm labor, cord prolapse, maternal respiratory distress. Ultrasound. Amniotic fluid index measures the fluid in the 4 quadrants. Deepest vertical pocket, normal 2 to 8 cm. Amniocentesis used for the genetic testing, fetal lung maturity and the infection screening. Amniotic fluid is mainly fetal urine after the second trimester. Protects, regulates the temperature, allows the movement and supports the lung development. Peak volume 1000 ml at 32 to 34 weeks, decreases to the 500 ml at term. Oligohydramnios causes include the renal agenesis, from placental insufficiency. Polyhydramnios causes include the maternal diabetes, GI obstruction, TTRs. Oligohydramnios complication. Pulmonary hyperplasia, cord compression, limb deformities. Polyhydramnios complications. Preterm labor, cord prolapse, maternal discomfort. Ultrasound is used to assess the amniotic fluid volume. Amniocentesis is done for genetic testing, infection screening and the fetal lung maturity assessment.